With that, we turn to State Health Director Dr. Cara Christ, joining us live from the Health Department. And thanks so much for your time tonight, Dr. Christ.
Thank you.
Okay, so why don't we start out, in your estimation, how is Arizona pacing with what experts predicted? How are we doing to flatten the curve here?
So I think we're lucky in the fact that we seem to be behind some of those other cities that have been hit really hard, such as New York and Seattle. It's giving us time to plan. I think with all of the mitigation strategies that we have put into place, we're going to do better than our projections and our scenarios. But every little bit helps.
Okay, we're talking about, we're now less than an hour out from this new stay-at-home order and essential services. We've talked about that. The governor said he wanted very much to do everything in his power to make sure that he's not impeding on mental health, people getting out to the parks and to the golf courses as they need be, but also businesses, opportunities for people to stay in business and people to stay employed. But we've had a lot of questions coming in asking about salons. If you're getting your hair done, if you're getting your nails or your toes done, that's not social distancing. What kind of advice are you giving the governor when it comes to those type of services?
So what we would encourage those types of services to do is to ensure that you're putting as much physical distancing in place as you can. So making sure that you're sitting people with it 6 feet apart, making sure that you're not letting people who are symptomatic coming in, you're making sure that your staff, if they have a fever, shortness of breath, or cough, that they are being asked to go home so that you can continue those services, but do it as safely as possible.
Okay, and I saw that the CDC is rethinking their original guidelines saying don't be wearing masks. It's only going to protect you if you already have something from spreading it to others. But if you are going to be doing a service where your provider, your nail tech or your hairstylist is pretty close to you, would you advise people to be going in wearing those masks?
We definitely would if you were symptomatic, but if you're symptomatic, we would ask you actually to stay home. The fear with the masks is that sometimes you touch your face a lot more, so it gives you a false sense of security. But if someone is going to be in your face, then it might not be a bad idea for just that very short period of time. But make sure before you put it on and after you take it off that you're washing your hands really good with soap and water.
So, Dr. Christ, we've talked also about so many businesses experiencing hardship right now and those restaurants trying to stay open. I know myself and a lot of neighbors have been trying to go get takeout as much as possible. We just ran a story the other day hearing from experts on a national feed talking about how they are assuring that takeout food should be safe because your digestive system would kill off this virus. But I'm hearing from others, like I got a text from somebody with a compromised immune system saying, if a virus can live on your hand and touching to mouth, how is that any different from food that might be infected? Touching your mouth, won't it live just the same? What's your advice, best advice for people with compromised immune systems, particularly?
So absolutely. So we always, it's the dose and the amount of virus that you get and the introduction. So if you're touching your eyes, your face, your mouth after somebody has sneezed or you've shook hands, you're going to get a higher dose than if somebody had prepared food and then you eat it and you swallow it and put it into your stomach. So there are digestive enzymes that are going to break that down. It's really coming into contact with that respiratory mucosa.
Would your best advice be to just use caution when it comes to like handling perhaps the plate that it's served in or the packaging that the food comes in, that you should still maintain caution using those things that the food might be packaged in, perhaps?
So yes, anytime you have an interaction with another person at this point, just make sure that you are washing your hands frequently before and after you eat, before you use the restroom and after you use the restroom, just to make sure that you're getting all of the germs off of your hands, because that's how you're going to spread it.
I have to ask about the lag in testing time. I know that we were waiting out the gate to get those tests in, and then now you recently sent out a directive to discourage testing, to have doctors and physicians treat their patients who are presenting as if. But I've heard from people who were told initially it would take 3 to 5 days. I think today they're in their 12th day of still living in this uncertainty. They're not getting the answers they need in the time they were promised.
So yes, so we do have a lot of demand here in Arizona for those tests. Those that are being run at a commercial lab, we are hearing are taking 5, 7, 10 days. The best thing that you can do is to make sure that you treat, if you've got respiratory symptoms, so cough, shortness of breath, fever, treat it as if it is COVID-19. So you're going to want to stay home, stay away from others, make sure that you're coughing or sneezing into a tissue and that that's going into the trash can, because the treatment for COVID-19 doesn't change. And then we would ask for anybody who does believe that they have it, if the symptoms worsen and you get chest pain, worsening fever, shortness of breath where you can't get enough air, that's when you should go into the emergency room.
Okay, so that advice for physicians to discourage testing and treat as if, how might that possibly potentially skew the statistics when we're trying to understand the severity and scope of what we're really dealing with here locally?
So we know that even with flu, we're only seeing the tip of the iceberg, because a lot of people, if they're asymptomatic or they have really, really mild symptoms, aren't going to go into the doctor at all. While I would love to get all of that public health data to see what it's doing in our population, we tend to get the people that are either sicker and are seeking care with their provider or in the hospital. So that does skew the data a little bit when we're looking at the severity of the disease. If we're only getting positive tests for that, we're not gonna have the full picture of what the mild portion of the disease looks like.
Right, and I know that President Trump just this afternoon is warning that it will be a next 2 weeks of very, very painful, predicting potentially 100,000 deaths here. Early on, he said July or August that we might potentially start to return to normal. It's hard to look into the magic crystal ball and have any predictions, but do you have any best prediction on when life in Arizona might start returning to normal?
I wish I was able to predict. We do know that we'll start to see the peak here in April for the number of cases. How long that will last will depend on our mitigation strategies, because really what we're trying to do is we're trying to lessen the number of people who get this disease all at once so that we're not overwhelming our healthcare system. But what that's going to do is that's going to change what the normal trajectory of the disease would look like and make it last longer. So we're going to be taking it day by day, just as we have, to make the best recommendations, because the thing that public health wants to do is to get people back to a normal life.
If we peak in April, I was talking to a friend who's in Washington State. Obviously, they're in a shelter-in-place versus our stay-at-home order or advisory. There is a difference there. So what would be the turning point if we should ever have to go to that route of sheltering in place? What would be kind of the pivotal change?
So we'll continue to monitor the data that we're looking at, and that includes a whole bunch of different factors, including the number of cases, the spread in the community, the health of our healthcare system. If we were to watch and see how our mitigation strategies were going and our healthcare system was being extremely stressed by looking at data on the number of admissions that they have and how many ICU beds and the availability of those types of resources, that may drive us to make further decisions.
Dr. Christ, I want to thank you and your team for all that you guys have been doing to try to stay on top of this. This is something we've never dealt with before. And I have to say, just because so many people are at home right now with idle time, what do? We Google. So I think there have been a lot of people sharing things on social media, a lot of conspiracy theories swirling around, people with idle time just Googling, questioning the origin of all of this. What context and perspective can you offer to people who are watching right now who are really struggling to grasp kind of how this measures up? Because we had swine flu, SARS, all those things, and we never saw the shutdowns or the changes at a state level and nationwide level as we're seeing with COVID-19.
So I think it has to do with the type of virus that it is. So this specific virus is very contagious and it causes severe disease in specific populations. And so trying to grapple with how severe the disease is and how many people it's going to infect has really changed our playbook this time. And so we continue to monitor Had H1N1 had these same types of outcomes, we might have seen a very different playbook back in 2009. But we've got a pandemic influenza plan. That is what we're following. This is acting very similar. And so we do have a plan in place that we are following.
Dr. Cara Christ from the State Health Department tonight, thank you so much for joining us. Any final words that you have for families who are now at home in the next 45 minutes until further notice, right?
Right. We would just say make sure that you stay home, you stay healthy, and you stay connected, because there are so many people right now who are feeling not only physically isolated, but socially isolated. So reach out to grandma, reach out to grandpa, and let them know that you love them.
Okay, we'll be keeping in close touch, and we appreciate the kind of breakdown and perspective, because it's true. A lot of people are starting to get concerned as things ramp up statewide, but you're doing your best to make sure that our families stay safe, and we appreciate that. Thank you.